Good morning, everybody. Thank you so much for joining us today. I'm Josie Osborne, BC's Minister of Health, and I want to begin by expressing my gratitude and respect for being here on the territory of the Lekwungen-speaking people, specifically the Esquimalt and Songhees nations. Joining us today for this exciting announcement are two very special guests. First in the room with us today, we have Dr. Olga Decker, a U.S. doctor who has recently relocated to Kamloops, and Nicole Dameron, a U.S. nurse who will soon move to Nakusp. The world around us is constantly changing with new technologies and new ideas and certainly new challenges. But there is one thing that remains constant: our universal healthcare system. It's rooted in evidence-based care and compassion, and here in British Columbia, we make a promise to care for every person, no matter their income. So when our American neighbors see what's happening in their own country, the erosion of rights, disregard of science, and the denial of universal healthcare, it is no surprise that many of them are looking north. And today, I'm proud to share just how many U.S. healthcare workers are choosing to make BC their new home. Since we launched our recruitment campaign last spring, more than 140 healthcare workers from the U.S. have accepted job offers with various health authorities around the province. And this includes 8 allied health professionals, 80 nurses, 16 nurse practitioners, and 38 doctors. This is thanks to the great work from Team BC, regulatory colleges for making their credentialing processes easier, Health Match BC for providing top quality services to prospective U.S. healthcare workers, and health authorities for the vital role that they play in attracting people to their regions. Just like Dr. Decker, we know some healthcare professionals are already working here in BC, in hospitals, in clinics, in care homes, and others are on their way. And we're seeing that some are choosing to relocate to rural and remote locations. So for example, Nicole, who we'll hear from shortly, is moving to Nakusp later this year, and we're going to hear that story. In just 4 months, we've received nearly 1,400 job applications from qualified American candidates who dream of living in our beautiful province. So far, more than 2,950 U.S. healthcare workers have expressed strong interest in relocating to BC. These are people who will contribute to strengthen our healthcare workforce to ensure that people throughout the province get the care that they need close to home. These incredible numbers are the results of work that we started about 6 months ago. Earlier this spring, we saw a chance to attract some of the most talented medical professionals to BC who would strengthen care in our communities. And so, together with our partners, we acted as a team. We introduced an expedited credential recognition process for U.S.-trained and certified nurses and physicians, and that has drastically reduced registration timelines. Since then, 29 physicians and 535 nurses have successfully registered to practice in BC. Over the summer, we also launched a targeted recruiting campaign specifically to select U.S. states. The campaign encouraged healthcare workers to follow their heart to British Columbia and explore opportunities through the BC Health Careers website. Our province is so diverse, and we welcome qualified healthcare workers trained around the world. And that's why the College of Physicians and Surgeons has held public consultations on a proposed bylaw change to further streamline the registration process for certain international doctors trained in jurisdictions that are recognized by the Canadian national certification bodies, the College of Family Physicians of Canada and the Royal College of Physicians and Surgeons of Canada. BC has so much to offer. It's a place where diversity is celebrated and inclusivity is the norm. We believe in science, whether it's vaccine safety or sexual health. We uphold reproductive rights and ensure that care is available regardless of income. And now, with more U.S. doctors and nurses who are joining our workforce, we will reduce wait times, improve access, and strengthen team-based care across the province. We're opening the door wider for qualified doctors who want to care for people in our communities. And an excellent example is Dr. Decker. She arrived in Kamloops in July and is now practicing at the Royal Inland Hospital. So I would like to invite Dr. Decker up to the podium to make some remarks. Thank you.
Thank you, Minister Osborne. It's an honor and pleasure to be here today. My name is Dr. Olga Decker, and in July, my family and I, we moved to Kamloops, where I started working at Royal Inland Hospital. Now, this decision was not made lightly. About in September of 2024, my husband and I started talking about moving to Canada from Charlotte area with our 3 kids, 2 dogs and a cat. We looked in Ontario area briefly, but realized that this does not seem like a good fit for our family. When we turn our eyes to British Columbia, we knew immediately that this is going to be our home. From the very beginning, HealthMatch BC and College of Physicians and Surgeons of British Columbia were very supportive. I applied in February of 2025, and the process was smooth every step of the way. That gave us the confidence to make this life-changing move. Now, only a few months later, I'm proud to be practicing medicine in Kamloops. My colleagues at Royal Inland Hospital has welcomed me with open arms. I've seen how much community values and relies on the care we provide. Now, of course, moving with a family of 5 plus a few pets, it's not an easy move, especially across the country. We had a few bumps on the way, but overall, it's all worth it. I was welcomed not only by local community, but also by thriving medical society. I feel great support from my medical colleagues who all work together to provide excellent care in BC. I also want to thank Royal Inland Hospital Foundation. They provided tremendous support every step of the way, and I wouldn't be here without them. BC commitment to universal healthcare, teamwork, and evidence-based medicine made it all worth it. I'm excited for the future, to care for the patients, to raise my children, and to continue contributing to improving healthcare in British Columbia. Thank you, Minister Osborne, to the provincial government, and to the people of BC for welcoming us so warmly. Also, very, very proud of my family who provides tremendous support, and they're my inspiration during this journey, and I'm very grateful for them. Before I wrap up, I also want that there is a lot of interest in U.S. medical societies about the process of moving to Canada. I hope that my journey and the message reaches more people in the healthcare south of the border and inspires them to follow my footsteps. I'm proud to call Kamloops home, and I look forward to many years ahead. Thank you.
Thank you so much, Dr. Decker. It's really wonderful to hear how warmly you've been welcomed and how the process worked for you. And we're so grateful that you chose the province of British Columbia. And I know that Kamloops is a better community for having Dr. Decker there and other physicians, nurses, allied health professionals that are choosing to move to British Columbia. And of course, that includes our commitment to continue expanding team-based care and the valuable role of nurses. And I am so delighted now to turn the podium over virtually to Nicole Dameron, who is joining us from another location, who will share a part of her story. Thank you.
Hello, good morning, and thank you so much, Minister Osborne, for your introduction and this opportunity to share my story. My name is Nicole, and I'm actually from Alaska, practicing as a nurse for the past 15 years. For me, the seed to move to BC was actually planted in 2017 when I attended a critical care conference in Denver and visited a HealthMatch BC recruitment booth. They were quite impressive to me then. And so at the time, we had a very young growing family and didn't quite have the capacity to make a major transition like this work. However, flash forward to early February of this year, we began to look more seriously at how to begin working and creating the life we wanted to in BC. And between my husband and myself, we do have 3 small children. We have both spent quite a bit of time in BC over the years, and each time we find the draw to stay much more difficult to resist. One of the things that strikes me the most when in British Columbia is the engagement of people with each other, their communities, and the commitment across the board to upholding values of respect, kindness, cultural humility, wellness, and reverence for nature. These are the values that we live by and hope to pass to our children. Since February, I've had the pleasure of working closely with the recruitment team at HealthMatch BC, and they've made moving through the process very smooth, as well as taken the stress out of managing all the details and complexities of the process. They've been very efficient, responsive, informative, and skilled in navigating an internationally educated nurse like myself through this journey. And one of the things that impressed me most with working with Health Match is their sincere desire to have my family and I settle in the community we love the best, and not only in our professional lives, but outside of it as well. I feel they truly embody the philosophy of finding work-life balance, and have appreciated feeling valued and welcomed at every step. This past summer, we spent a good portion visiting communities throughout BC in person and have chosen the Lakeside Village in the Cusp as our new home. I'm so thrilled to join my colleagues soon and providing care for the community at Arrow Lakes Hospital starting in late November. I personally believe one of the greatest indicators of the true health and well-being of a society is their access to healthcare rather than barriers created to deny it. I'm very passionate about my profession and want to be a part of a care team that upholds these values as well as evidence-based practices in medicine. So thank you very much.
Thank you so much, Nicole, for sharing your story. We're delighted that you're choosing to move from Alaska to Nakusp, an incredible little town that I've had the pleasure of visiting many, many times, and I know you're going to find a really, really great home in the community there. And we're really happy that Health Match BC provided the personalized services that you needed, and Dr. Decker that you needed as well. And on behalf of everybody in BC, I'm really thrilled to welcome both Nicole and Dr. Decker and all the other medical professionals who are choosing to make BC their home. So thank you again for joining us today. And with that, happy to turn it over for questions.
A reminder to reporters on the line, if you'd like to ask a question, please take yourself off speakerphone or Bluetooth, then press *1 to enter the queue. Media in the room with questions, please line up at the mic. You'll be limited to one question and one follow-up. Please state your name and media outlet.
Hi, Alec Lazenby with the Vancouver Sun. Minister, obviously you've got some more numbers for us today, 80 nurses, 38 doctors. How many of those are moving to rural communities? Obviously we've got Dr. Decker here and Nicole, but how many people are moving to rural and remote communities throughout BC, and what's the incentives for them to do so if they do decide to move to the province?
Thanks for the question. I don't have a breakdown specifically of those numbers and how many are moving to rural communities versus urban, but we'll do everything we can to get you that information afterwards. It's very exciting to know that people are choosing to move to rural communities like Nicole, going to Nakusp, for example. And I know that so many communities are putting out the red carpet, so to speak, working with health authorities, with their divisions of family practice, and through the local governments to really welcome people and find that right match. That's one of the really important roles of Health Match BC, which is helping to work individually with each prospective healthcare worker coming to BC to find the right match there. We need doctors, physicians, nurse practitioners, allied health professionals in communities large and small, and we'll continue to do everything we can to incentivize people to move out into rural communities, which, as those of us who are from rural communities know, are just wonderful places to live.
In terms of my follow-up, we are at UBCM here today and this week. I imagine you will be hearing from lots of municipal officials about the issues with healthcare in their communities, everything from ER closures to lack of ambulance services. You had a panel on that earlier today. Just wondering, what are you hearing from municipal officials? And this has been something that's been an issue for the last number of years. It's not a new ask from municipal officials. So what are you bringing that's new this year to bring to municipal officials and say, here's how we're helping address some of those challenges?
We did just have a 2-hour session with local government officials from around the province, but with a particular focus on rural and remote communities, on retention, on recruitment to those communities, and really talked about the all hands on deck approach that BC is bringing to the table. When we look at this U.S. healthcare worker recruitment campaign, that's exactly what we're bringing into communities large and small across BC. That's something that's maybe newer than what local governments have been able to do in the past. We're inviting them to sit at the table with us, with health authorities, with unions, with the divisions of family practice, with the local government representatives, business organizations, and really take a focused effort on matching the healthcare worker to the community and doing everything we can to create what a whole family needs. What I'm hearing from local governments is a recognition that recruiting a healthcare worker is more than just that individual. We heard it from Dr. Decker. It's about your spouse, your children, your pets. It's about finding the right match for people. And I'm delighted to be here at UBCM. I know I'm going to be hearing from local governments throughout the week about the challenges they're facing. They're going to find a very receptive and listening health minister and government that's committed to working with them.
Francis Plaude, Radio-Canada. First question, how are you working with the federal government to improve, accelerate the immigration process for American healthcare workers?
Yeah, this is a really important question because of course, most of the immigration policy levers are at the federal level. And it's vitally important that the federal government hears us and knows that they need to do everything that they can to help us expedite the arrival of American citizens who are coming to British Columbia to be able to work here. The provincial nominee program, which has been a very successful program for British Columbia, of course, has seen cuts in just the last recent years. And there is a concerted effort in really advocating strongly to the federal government and requesting that that be changed. And again, this is not unique to British Columbia. There are provinces and territories across this country that are bringing in workers, and it is incumbent on the federal government to work more closely with provinces like British Columbia to make sure that people can get here quickly and as smoothly as possible.
Second question, you campaign, you started this campaign, very obvious campaign in Oregon, Washington State, and California to recruit healthcare workers. Has it led to any backlash or discussions with representatives from those states? Because it's pretty obvious that you're poaching healthcare workers when they also need some.
Well, certainly nobody has reached out to me to express their displeasure. We know that this is a situation right now. We're taking the opportunity, really seizing on it at a time when things are very uncertain in the States. And we know that people who choose medicine, who choose healthcare as a profession, they are here to serve people. And coming to British Columbia, our universal healthcare access, where it does not matter what your background is, what your income level is, that you deserve the best quality healthcare, is something that really meets the values of why people choose to go into healthcare. Having a single payer system is something very attractive for a lot of American physicians, for example, moving here. And then just knowing that we have warm, welcoming, inclusive communities where we celebrate diversity, where we uphold reproductive rights, where we uphold the principles of science, and that we take evidence-based approaches to providing solutions for people is something that is, we heard it directly, I think, from Dr. Decker, that this is one of the reasons why people are choosing to move to BC.
Hi, Emily Joveski with Vista Radio. What are your thoughts on communities like Colwood who are introducing municipally run clinics, and could that be a model that plays a bigger role across the healthcare system?
What Colwood's done in establishing a municipally owned primary care clinic, putting physicians on salary and helping attach them to patients is something new for British Columbia. Really happy to see local governments approaching the province with new and innovative ideas, and we're going to do everything we can to support them. I know that a number of other communities around BC are looking at Colwood and determining whether that is something that might be a good fit for them. Every community is different, and local governments really know their communities best. So they know the advantages and strengths. They know what people need. So being able to come forward and have that dialogue with the health authority, with the Ministry of Health, to find a model that works for them is something that we're going to continue to listen to local governments and do everything that we can to implement the solutions that they're coming up with as well.
For my follow-up, I wanted to ask about the provincial rural retention incentive. We were talking about incentives earlier. I believe that was extended until September 30th. Will the province extend it again? And how do you respond to concerns that healthcare workers could leave those rural communities once the incentives dry up?
The incentives were brought in about a year and a half ago as a one-year commitment to try to do everything that we can to honor what healthcare workers bring, particularly to rural and remote communities, and some of the struggles that people do face. Retention is very important. We know that that pay and incentives, financial incentives, are one part of a solution. But part of the solution also is creating the kind of workplace and community to live in where people choose to live there, regardless of whether there's an incentive or not. So the incentive program continues at this point, but everybody's aware, and we've been very open with unions, for example, that the province is undertaking an analysis and a look at the incentive program to make sure that it's working in the right way and in a targeted way, and that we're seeing the results that we intended.
Yeah, Wolfgang Deppner, Canadian Press. Thank you for taking my question this morning. Minister, about this time last year, Premier David Eby pledged that BC would recruit 45,000 new healthcare workers within the next 4 years. I believe that was part of his election promises. Based on the current numbers that you've provided us here today, how satisfied are you, or how confident are you that BC is going to be able to reach its numbers? I know that not all of these new healthcare workers are supposed to come to the United States. That would be an unfair comparison. But can you sort of talk about the pace of the recruitment? How satisfied are you with the recruitment? You said 2,950 strong interest, but only 140 actual healthcare workers. Can you sort of contrast expectations versus reality? Thank you.
Thanks for the question. I'm really pleased with the record, what we're seeing so far and the track record that's being established, taking into account the fact that it takes time for a person to go through the process of seeing an opportunity, inquiring about it, learning about it, and then doing all the work at home with their spouse and family and making a decision about moving to a new country. I think we're doing very well with respect to that. And it's going to take some time to see as we move from website clicks to people that are taking webinars to being matched with a person at the being matched with the person at the Health Connect and the health registry to make sure that they're getting that personalized service, to making an application, to receiving a job. I think everybody understands that that does take some time. So to know now, since announcing our intention to undertake a campaign in March, actually launching that campaign in June and July, here we are in September, and we've seen 140 job applications or jobs accepted is good. So it bodes well.
This is actually a question for Dr. Decker. Dr. Decker, can you tell us, and I know it might be an unfair question this early about your salary, but can you sort of talk about the level of salary that you received in the United States versus the level of salary that you're drawing now in Canada? Thank you.
Thank you for your question, and I guess it is a fair question. We all have families to support. I only recently started working, so I don't have the full year analysis, but I'm confident to say that compensation is very compatible to US, if not higher. So I think that's also a lot of US physicians or medical professionals don't realize that we're not only appreciated on personal level, but also on professional level. We are well compensated. So hope that answers your question.
Okay, all right, thank you.
Thank you.
Hey, Minister. Rob Shaw, Czech. Just one question for you. Be a big discussion on the UBCM floor later today about street disorder. There's a big mental health component of that. You're going to hear from mayors, I'm sure, who say not enough progress has been made on involuntary care, on other parts of the Mental Health Act, and other parts of the healthcare system. What are you going to say to them, and what do you say to that criticism?
Well, first of all, I want to recognize that local governments really are on the front lines, that leaders are facing the questions from their constituents and community members and doing everything they can to ensure that their community members are safe and that they're well cared for, and that we are working together all as partners to do everything possible to reduce street disorder and help make sure people are safe. This government has taken extraordinary steps in building out a full continuum of mental health and substance use supports, and recognizing that we must do that from early intervention and prevention with youth, for example, in schools, better access for youth to primary health care and other services that they need, right through to harm reduction, adding hundreds of treatment beds, recognizing that recovery is part of this, and that people will need support on that journey, for some for the rest of their lives. everybody knows we've taken very seriously the issue of people living with concurrent disorders, with severe mental health illnesses, with acquired brain injury, perhaps from repeated overdoses, and that there is a small proportion of people out there who simply are not in a position to be able to make the best decisions for themselves, and represent a growing issue for people who want to do the right thing with respect to caring compassionately for these folks. And we've making big steps on moving forward with involuntary care, establishing the homes at Alouette in Maple Ridge, the designated mental health beds in the Surrey Pretrial Centre to provide that kind of care is the move forward that many mayors are talking to me about. They have great interest in seeing that in some of their regions, whether it's up north or in the interior on the island. And it's our commitment to continue to expand these kinds of services. And we're going to continue to work with Dr. Vigo, of course, in this work and addressing that. And to those local government leaders, they are strong advocates for their community. They are making their voices heard, and we are sitting down and having those tough conversations with them, and we'll continue to partner with them in every way.
Minister Katie DeRosa from CBC News. We've been talking to several family doctors who say that the fee code for vasectomies hasn't kept up. It's only gone up about $5 in the last decade. And as a result, many family doctors are taking away vasectomies from their services. And the only other option is private, including in Greater Victoria, now $2,000. So what is your government doing to increase access of publicly funded vasectomies?
Yeah, thanks for the question, Katie. Definitely, we've been made aware of that too and had conversations with physicians on that. So it's something that we're taking into consideration. It's very important that people are able to access reproductive health services, whether you're male, female, or non-binary, and making sure that those choices and options are available for people is incredibly important.
So just are you considering increasing the fee code? And also a different topic, the Trump administration is expected to make a link between Tylenol in pregnant women and autism. Are you worried about a similar trend, or perhaps here pregnant women will hear that and influence their choices here in BC?
It is incredibly alarming what is happening in the States, and to see something like this where there is an unproven link between the use of acetaminophen and autism, that public officials would stand up and speculate this way, creating fear and uncertainty for people who need and deserve the best health care possible that is based in evidence, that is based in science. That's exactly why we are recruiting US-based physicians, nurses, and others to come to British Columbia, because this is a province that understands and values science, that uses science and research as the underpinning of these kinds of public policy decisions and delivering the best medicine, the best healthcare for people. We're going to continue to do that. We'll continue to celebrate that and invite people to be a part of this evidence-based healthcare system that is universally accessible to people, no matter what their background, what their income.
Hi, Mary Brooke from Island Social Trends. The Colwood Clinic that just opened, and you saw some coverage on it last week, is run through the city for municipal payment of the doctors, and it's exclusive to Colwood residents. So I'm just wondering how the health ministry feels about one municipality serving only its own residents and how that fits with universal health care.
Thanks for the question. Colwood has taken a big step forward in coming up with a solution that works to support their residents and healthcare workers who are working there, the physicians and others who are working at the clinic. And that's part of the discussions, I think, that takes place between local government, the health authorities, and the Ministry of Health. Of course, our goal is to see everybody who wants to be attached to a physician or nurse practitioner or primary care provider to have the ability to do that. And Colwood is helping to improve the situation. Again, we invite other local governments forward to have those discussions, and many are looking at what Colwood is doing. We are also going to continue to do everything we can through training more professionals, recruiting more professionals to come to communities. We're seeing attachment rates of almost 700 people a day being attached to a primary care provider. We know that we are delivering, we're seeing things going in the right trend, the right direction, but there's still an incredible amount more work to do.
And also in Colwood, the health long-term care center that's being developed there, is it still a target date of 2027 for completion? And it's not just seniors long-term care, it's also for the brain disability patients.
I will get you that information, Mary. Thank you.
Okay.
Okay, now we will go to the phones. We have time for one question. Well, just a moment here. It looks like they may have. We don't have time for one question. There we go.
There we go.
We'll wrap that up for today. Thank you for
Thanks
joining
so much,
everyone.
everybody, for being here.